baby bath. And that is something you need special qualifications to do. That's what is being drilled into our head, that baby bath is something which can be given by only a person who's specialized in that. There's nothing like that. The only thing is make sure that the specific areas are cleaned properly and the baby is not aspirating water while giving a bath. Usually the bathing is started after the umbilical cord falls off, usually 10 to 14 days. Basically, the idea is once the baby is at home and the baby is accustomed to the temperature and climate there, and the umbilical cord falls off around that time, and then you can start giving bath. And the vernix, which is the whitish substance which is there on the baby's body initial days, it gives a protective covering as well. So until then you just need to give sponging of the baby, and there is no need of giving a proper bath. And it's also mandatory in preterm and low birth weight babies. The baby has to cross at least 2 to 2.5 kg before getting their first bath. It is something which is out of their comfort zone, so it is always good to talk and sing to the baby while giving bath, so that they feel comfortable. They know that there is some regular caretaker near to them. Undress the baby, cover the baby in a towel, use a mat, make and prepare lukewarm water kept ready before the bathing is started. You can use oil massage, use coconut oil or olive oil, avoid perfumed oils, and you may give massage which is not very scary to see. See, you cannot change the shape of the baby by giving 5-10 minutes massage. So pulling their nose out and trying to make their chest wide by massaging, all these things can cause actually injuries to the bones and fractures. Most of the pediatricians would have seen it at least 1 or 2 cases. So try to avoid scary massages. Make sure that specific areas in the body are kept clean, mainly eye care. Use wet cotton, use clean cotton, use clean water, wipe it from inside out. Use 2 separate cottons for both eyes so that there is no cross infection. Ear care, clean the ear, outer ear with cotton. Whatever is there, whatever wax is coming out, you may clean it. Never try to put in a earbud because it usually pushes the wax inside and it's not going to help the cause. Skin folds near the neck, cubital fossa, groin, all these areas should be cleaned separately and with utmost important, because these are the areas where the debris, the hair which has fallen, the skin which is peeled off, everything gets deposited, and these areas need to be cleaned with special importance. The genitourinary area and umbilicus are 2 other areas. Genitourinary area, make sure that in boy babies the skin is slightly retracted while cleaning, and wiping the area with wipes and cotton cloth multiple times. Usually the 2nd and 3rd week they pass motion multiple times. Every time you try to wipe it, it's going to damage that particular area. So use lukewarm water and clean the area and mop it dry. Umbilicus, once it falls off, there may be slight bleeding for 2-3 days. Clean it properly, keep it clean and dry, and it heals off properly. There is no need of antibiotics or anything as a routine unless there is an infection which is noted. And while giving bath, make sure that the head is held in such a way that the water doesn't fall on the face and the baby doesn't aspirate. And you may use baby bathing bars and shampoos. Baby bathing bath, it's not soap. Soaps are actually alkaline pH, and baby skin has got acidic pH. So what we use is Sinden bars. Most of the baby bathing bars which are available now are Sinden bars, and they are of acidic pH. That's the one which is used now, which is recommended. And baby shampoos are recommended when there is cradle cap or something which like something like a dandruff in adults. When these things are seen, shampoos are also advised. And make sure that the baby is mopped dry and not rubbed vigorously. That can cause danger to cause injury to the skin. After the bath, you may use moisturizers, but try avoiding using powder. Powder, in fact, should never be let into the baby's room, because you dust the powder, and most of the time what happens is the baby tend to aspirate it a lot and cause nasal discharge and cough and things like that. Using kajal is also a problem, especially when it is used inside the eyes. It can block the lacrimal duct and cause tearing and then later conjunctivitis. The rest of the areas which need special mention are, one, again, the umbilical care. Until it falls off, make sure that the diaper is tied with the umbilical cord outside, and the umbilical cord is not within the diaper, which can cause soiling with urine and motion. And keep the stump clean and dry, and once it falls off, you need to wash the area properly and keep it clean. Nail care. The baby's nail can be cut using nail clippers or filers, avoid biting it off and using a blade to remove baby nails.